Waiting for a long time.
No, sir, that's absolutely right.
Jaw symmetry, something. I think I
We spoke, sir, on the
exactly
video.
advocate. I remember quite some time ago though.
Yes, sir, then it took a while for me to plan this.
Alright, can I have you take your specs off, please?
Okay, I'm having a little, pimple here, so like this.
This one a bit.
I do have old pictures for that.
No, that's okay. Okay, right. There's a couple of things I want to tell you. One, the chin is definitely moved towards the left. So we can move it to the midline. We can also bring it forwards a little bit. I don't think we need to increase the vertical height, only horizontal. So that will be nice. Second thing is, this area is a little swelling. This area is like weak.
Yeah, this
Straight.
is heavy.
Yeah. Now, you like this side better or you like this side better?
I do like this side.
So we have to get this down to that side then. All right. So we can do that as well.
When I'm talking or when I'm smiling, I think it looks even more worse. Like, see, I mean, this is just like a random picture.
You mean the asymmetry looks worse?
Yeah.
Sure.
Yeah.
Yeah, that happens like that when you smile.
Like, this is without the swelling. I mean, this is a little swollen today, so this is much more leaner. So I like this side better.
Sure. That's all I need to know. So what I'm going to do is, we're going to get the chin in the middle.
Correct.
We're going to get the chin forwards. We're not going to increase the vertical height. And I'm going to try and get this side of your face, especially the lower third, onto this side. Now, I might achieve 90% of this, okay? May not be exactly 100%.
Right.
Because, there would be a muscle, bone, contouring. I'm still going to measure all of this on the scans and work on it. But still, end result could be, at least it won't be like visibly
This is quite
evident.
basically.
Yeah, that won't happen.
And when I'm talking, I don't understand. How is it that when I'm talking, it is more predominant? Like,
More visible.
Yeah. I mean,
Because I think the muscles move differently. That we can't predict correctly, right? When you speak, when you are animating, the muscles move with their nerve things, and so that's why it's more evident. Now that will of course get better with surgery. I don't think it should. That's why we're doing all the
because
surgery.
when I talk, the jaw should come down, like, not like, because now I'm talking, it seems to get going in this direction.
Absolutely.
And what I really want is that when I'm talking, because my job is like mostly to talk one-on-one, and I don't want that. It should be clear, like, ऐसा visible now, it should be subtle.
नहीं वो तो हो जाएगा ना.
Yeah.
वही objective है.
वो objective है, and that is actually when I was a little healthier, then ज़्यादा I couldn't really place it, and I was not even that much concerned. It's just over the years I've started to realize that it's gotten worse with time.
It will be the same even before, but you've noticed it more now. And if you're chubbier, then maybe
Yeah, maybe
you were not evident. I mean, but it will be the same. This happens.
I also had this issue about my, like the under eye thing. I got my corneal transplant, I think 6-7 years back. After that, I've noticed that maybe because more stress in the eyes, this has become very, puffy, always puffy.
It's not because of the corneal implant. That happens very often for a lot of people.
Okay.
You can correct it very easily with a blepharoplasty.
So this can be okay.
Easily
right?
with the blepharoplasty. Yeah.
And the other concern was like about these lines.
Grooves.
So, and abhi say I'm looking 50 already. So
Not really, but but we can make you look younger. So this we can do a blepharoplasty. That's a simpler procedure, like a daycare one.
Correct.
The nose part, see, two things can be done. The most appropriate one will be a rhinoplasty. I'll tell you why. Because this is a little bit curved. This is one is a little bit concave, other is a little convex.
Okay.
Then the nose is not exactly in the middle. It's a little bit towards your left, and it's a bit too strong on your face.
It's like a little, like, a more thick.
And because it's a little bit more strong, then this looks a little extra weak. So that balance is not so much on the face. So by doing a rhinoplasty, you can get in the midline more subtler nose, and that'll look much better. That's best option. Second
And
is,
these lines also will
yeah, that'll go away with that.
Okay.
Not go away, but it's going to get less prominent or less deep. So look tighter skin. The other option is not do any of the bony work, only work on the alar base and do what is called as an alar plasty.
Okay.
You're not a very ideal patient for that, but still that can be done if you desire a less invasive procedure. That's an option. And the other option is, since you're with me, you should get some hair transplantation done if you can, to just get this part covered. Because what's happening is your forehead is it's taking a huge curvature on the back.
Okay.
So
Yeah,
if you
like-
cover that,
Okay.
come here on the mirror. So that give you like a much more proportion in the face. These are all the things that also. It's an easy procedure. The most difficult of all the procedures we've discussed till now is your jaw. Yeah, because you have to cut and move and plate and blah blah blah.
I don't want to suddenly do it.
ठीक है, बाद में करो. Just I'm telling you because you're here.
Because
This is going to look no different. Only the thing will go away. Puffiness only will go. There will be a difference. So maybe don't do that also, just because you don't want to look different. So just do the chin and this.
but I definitely want to get rid of these. So then you'll have to suggest me whatever is. I don't want a very pointed nose also, like like
No, but you're okay with the rest of the nose? You're fine with everything, the slight bend and everything?
I know what you're saying.
Yeah.
I have, I'm taking a minute more.
No problems.
So I do know what you're talking about.
Yeah.
This little thing.
Yeah.
Right? So, malab, how can it be not done totally and like just thoda sa aisa bhi ho sakta hai? Like I don't like the ideal nose, which is like like the.
नहीं वैसा नहीं
ऐसा
करूँगा.
है.
हाँ, no.
But maybe you're right, because this is very big for the face that I have. Just maybe like a less subtle.
You happy without doing anything as well? Because you asked me for an opinion,
Yeah,
I
yeah,
said
yeah.
we could do that, but
But then how to get rid of these? Which is the best option then left?
the best is to do a proper nose job for you.
Okay.
The second best is to do only a work on the alar base, because your nose is not too broad as it stands in relation to the height. So I don't want to only reduce this and make it very narrow. That doesn't look good either.
Correct.
So that's why I think that will be a second good option. And the other option why it will be good is because when you work on the shape of the nose and put it in the center, and that will give you a much more balanced face, nose and all of that. But as you say, if you don't want a lot of change in one go, because see, you are an advocate, and I mean obviously you don't want somebody to say, hey, you've got something done to face.
Yeah, exactly.
And if you do everything that I'm suggesting, that will happen.
I look quite
Not
different,
totally
perhaps.
different, but people might ask.
Yeah.
It's going to be for the good.
Correct. That is true.
They're going to try and find out what you did, so they'll get it done maybe.
But they'll be like, are you like
But-
influenced by Kim Kardashian or something? Like, don't want to give that image yet.
But that people will ask.
And like for the lines, can it be like little, maybe not
See,
touching?
you're doing this now, right?
Yeah.
That will happen when I do the chin already.
Okay. So, I mean, I'm taking your opinion कि आप बताओगे.
तो मैं because see, your main concern was this, and so we'll just stick with that. And बाद में अगर आपको लगता है कि if you want to do this, that's a simple thing.
That I have.
वो तो आराम से वही प्रोसीजर में आपको इसके लिए कुछ भी एक्स्ट्रा मतलब टाइम भी नहीं लगेगा. That we
वो
can
I
do.
want to get this.
तो वो
done
दोनों कर
definitely.
दीजिए. नाक एंड दिस यू लीव इट.
No, but ये
अच्छा,
तो
वो करो ना.
चाहिए मुझको. ये I mean this is
Why I'm saying leaving it is because इसके बाद शायद आपको काफ़ी टाइटनेस मिल गया and you are happy, then क्यों कराओगे? And then if not, you can do a full rhino later on. You have the option.
you think that ऐसे इतना टाइट हो जाएगा कि
काफ़ी इम्प्रूवमेंट होगा.
but if you scaling from this side ऐसा तो नहीं होगा that it
Sags?
Yeah.
No, that's why we're going to bring this forward. No sagging will be there. Your skin will get tighter 100%.
but then ऐसा ना हो that ये दिखता रहे यहाँ से तो अच्छा लग रहा है यहाँ से ओल्ड लग रहा है. Because of course I want to look younger, you know. And so ये वाला चीज़ मेरे को काफ़ी टाइम से कंसर्न कर रहा है. ये भी when I'm smiling all the time, you know, it's like double lines have started to come. So ये bother करता है. And ये भी अब bother करने लगा है because every morning this is even deeper. Like by the day goes, it becomes a little subtle, but it's now definitely there. My mom doesn't have such strong lines, like I have already. So you know, I mean, because
So
now that I've come here, पूरा काम ऐसे पूरा block करके, I've taken out like almost a month for myself.
awesome.
So
Then you go for a full nose job if you have taken a month for yourself. I would recommend that rather than just do the LR part. But you make your call. I mean, if you really want me to do that, I can do, or we can
and
do
that
it
will
later.
also happen in the same go, right?
Yeah, I can do everything in the same go.
Okay.
But then the only concern will be about you looking quite different. So that's something you'll have to just get used to. People will know when you do a lot of things, and especially like, you know, when we do multiple things like this, we call it face makeover.
Correct.
Because like, you know, chin, angle, nose, eyes and forehead, oh, there's going to be a lot of difference. But you can look at it in a positive way. I don't know how each person, it's about how you want it actually. Some want subtle changes and don't want people to ask them. Some are okay even if they ask. So that's your call. I can't say like, you know, what will suit your situation. But see, the good thing is, whatever you choose, these are all things you can do little later or hello. That you make a call and it's elective. So ऐसा नहीं कि आपके पास टाइम नहीं रहेगा. हाँ, निकलेगा 10-15 दिन वापस, but then you have the benefit of maybe not doing it.
Correct.
There are people all types, okay, like I've in my experience I'll tell you. So there's, I would think a lot of them come back if they decide a surgery, but there are small percentage of people they'll feel डॉक्टर साहब काफ़ी दर्द हो गया था वैसे जो आपने बोला वो सही नहीं था, and then they will like नहीं it's fine, अभी I'm very nice now and my husband is very happy or somebody is very happy, so I'm good. That also can happen, which is good. And then some will be like, no, I'm good, I want to get better, they come again. So you can make your call. Generally face makeover and all, you know, like everything people who do are like going through a rough patch in life, or they want to move to another country, another job, they're getting a promotion, they're starting a new venture, they're suddenly doing something else, I don't know, they want to look a little different, something better. That's
and they
the
reach
thing.
their 40, so I reached my 40 this year, so maybe that's
Oh,
why
any age, Baba.
something has come up in my mind. Now I have to do something different.
No, it happens with people any age. Even many of the some of the patients, like they come with their kids, you know, they're going to get married. They ask
that
like
is
that.
one thing that definitely Indians are very
Still
much
crazy about it,
affected by.
and more in the south. Maybe in the north as well. I don't know much about that there.
Absolutely, in the north also.
हाँ, here बहुत होता है. So that is one time when they want maximum done in one go, which I understand. And other than that, so you let us know how, given
So
an
what's
idea.
like the recovery periods are like approximately?
So the job will take you like a month. The nose also will take you 3 weeks. This will take you 1 week. Hair will take you, if you do 1 week, 10 days.
I'm here. I have booked my ticket, but I can like extend. I'm here till 8th. I think that will be okay because
Yeah, I think it's fine.
after
But depends on what all you want to do now. Just the chin and the eye, right? That's okay.
that's alright. So maybe I'll think and talk to
Yeah.
mom also.
Talk and let us know.
Yeah.
Another thing, no, as we add procedures, like then we need to add 1 or 2 extra days per procedure
Correct.
as we're doing more. But these two, 1 week is fine.
Okay. Alright. So I'll just I'll.
Talk, take your time.
But you're saying that once this will get done, there's a lot of possibility that the lines also will decrease to an extent.
No, unless we do the nose, the lines will not decrease much.
Okay.
These lines.
And not with alloplasty also.
Elaplasty will decrease.
Okay.
Definitely it will decrease with elaplasty. But elaplasty, what can happen is, see, there is a slight bend to your nose. This right side is concave. The left side is convex. If I narrow your nose by doing elaplasty,
It'll become more visible.
that's my thing. It can.
Correct.
Then people should not more obviously say, nose theda hai.
Acha,
And you'll say, okay, doctor, you've done this and made my nose theda. But reality is not that.
No,
Bas-
that I've noticed in my picture. I've, like, you know, कि
That's
यहाँ
why
पे ये चीज़ तो है.
this is the reason why I'm saying not to go for elaplasty. Elaplasty में ये तो हो जाएगा आपका सही. But you don't want to trade this improvement with this. It's not going to worsen, but people might notice it more.
And how about like a slight lift here?
Facelift? No.
Like maybe for the lines only, like, you know.
A little bit. I don't think you need facelift now. So you can keep that for when you reach 50 maybe.
So for the rhinoplasty,
This thing.
maybe I'll, you know, like reflect on this
Think
thing.
about it. Even that you can do anytime. Why I'm saying, see, this procedure we're doing in the job, I call it reverse facelift. Because the procedure we're doing is opposite. See, this is pulling like this is pulling them down. This is with the bone, this is only soft tissue. But the effects are also kind of similar. Hence, you're in that. We've done both for patients. The 65 or 63 or severe issues with jowling and short chin. I do both. But in your case, no. Just that would suffice. Facelift. Or what I'm doing. This is better because we're correcting an asymmetry. And then you can always go and do that later on. So then there's no role for that procedure.